Differentiate? I mean, I understand that in Asian nose is it's more flat and more short. So we have to enhance the nose in an Asian aesthetics, whereas a Caucasian nose is more elongated and more sharp, and they want to kind of reduce the nasal shape. Is that right?
Yes, that's right. For Asian, we have a much flatter and smaller and shorter nose. For the nose bridge and for the nostril, we have broader and wider nostril, and then we usually have more choppy nose tip. And so the shape is very different. So for the shape is not as well defined as Caucasian. And so nose filler actually in my clinic is the second most popular after the toxin of the mosquito. So you can imagine most of Asian girls have a flat face and square face and but flat nose. So it's very common in Asia. So nose filler in Asia, I will focus on mainly two parts. One part is the definition of the nose bridge. The second part is the shape of the nose tip. So it's two parts. So for the nose bridge, we add height and volume to make it longer and then higher and then better definition. For the nose tip, using the filler to make it narrower and more definition on the columella and narrower nostril and then better shape of the nose tip in general. So it's for Asian nose.
Filler fills and it actually gives more volume, but we want to make the nose more sharp in an Asian face. So how do we do that?
Filler is fill up, but also definition. So when we choose filler for nose, we choose a very high G prime filler. So which means a very stiff product. We are not using all different product for the nose, but we are using very specific product. Although they are all hyaluronic acid or they are the same ingredient, but different product has different characteristics. So we will use a very stiff one, and those who will not be widened or those who will be less gel-like. So those filler is more suitable for nose, and then for better to make a definition of the nose bridge. For the nose tip, so actually the idea is not filling up the tip, but the filling up of the area under the tip. So it's like the columella. So we doing this part, but under. So when we fill up the columella at the front, the nose tip will become more bringing forward. So the nostril will be narrow. So this is like building up a tent. So we build up a higher tent, so the surrounding will be more narrow. So actually, for Korean doctor and some Hong Kong doctor, and also becoming more popular, they will use thread leaf in the nose and also the nose tip to achieve this kind of effect. But actually, in my opinion, this effect can be achieved also by filler, but more safe. So I will prefer filler instead of nose thread.
Why is everything so popular and everything is so coming from Korea? Why are they so ahead of everyone else, Dr. May?
Korean doctor is very innovative, and then they are very brave to try new things, and then they are very creative. So also this is their benefit, right? And also the environment in Korea is that the client will trust doctor very much. So actually they will not like us, or not like the doctor-patient relationship in the United States or other Western country, is that they're not like discuss and then oh, what I want and then what you want. The Korean doctor and then Korean client would sit down, and then the Korean client would lie down and then let the Korean doctor do without explanation. So they trust doctors very much, and then they don't complain. And then it's like a doctor is a very high in authority. So when they come into their clinic, they will trust them, and then they will let them decide. So they have Korean doctor have a lot of rooms to try and error. You can say, and then they try new things, and then they find out very good, effective method, and then they will go for clinical trial to see if it really has effect, and then they will publish paper, and then the product will go worldwide. So usually they will try in the clinic first.
Procedures which originate from Korea and they travel to the rest of the world, by the time they become a thing in the rest of the world, they are already obsolete in Korea and they have moved on to something newer.
Yeah, that's true. That's true. Really true.
So do you do much lasers in your clinic?
Yes, I do. I also have a pico laser, so, and the CO2 laser. So I will do the pigment and then the scar and also the wart removal. So I also have this kind of clients. They will come and to my clinic and said, oh, okay, doctor, I only want to improve my skin. I will usually do an initial assessment. So the initial assessment including skin analysis with the machine, so that the machine can tell what kind of treatment, what kind of pigment she has, superficial or deep pigment, or the distribution and the blood vessel on the face, all kind. And then most importantly, I'll do the bedside assessment. I will do it in front of a mirror. I'll ask the patient to hold a mirror, and then, so most of them will see what I see, because with the mirror, so they will understand, okay, the reason why I look aging is not that only that little spot, but actually it's the skin fold or the sagging or the wrinkles. So they will start to understand. Some people don't know how to express their idea or their concern. They can pick up the most obvious things. So the most obvious thing, the most different from before and after is the spot, right? But the whole picture is like, okay, you lose volume, and then you go sagging, and you have a lot of lines. So it makes you look older or tired. So when they have the mirror, and then you ask them to look at the mirror, usually they will understand.
Can lasers revolumize? Can lasers give us the volume back? Because lasers can stimulate collagen. So is it true that they can volumize as well?
No, no, because laser, because how deep can the laser go? How the deepest laser can go to only superficially, only to the skin. We cannot go through the skin to the dermis, or to the muscle, or to the bone, right? But the aging actually is not just the skin. The aging of our face, including the skin underneath, the fat, and the muscle and the bone. So the laser can only do superficially, and we cannot using, or even if those lasers are collagen stimulating laser, cannot replenish the loss of volume of our face. So I think for collagen stimulating, they can do at most is the pore shrinking, and then the atrophic scar, the acne scar improving, and also the fine line of the skin, also the skin texture, the improvement of the skin texture, but cannot do the volumization of the face.
Right, but it's all coming together, because they all these treatments that you're talking about, they are done together to achieve the ideal results. We've spoken quite a lot about the beauty from exterior, but this is my personal belief that the true glow on the face, it does come from the inside. Like diet plays a big role. Collagen stimulation can be done with the right kind of vitamins, the right kind of supplements. So talking about supplements, do you believe in oral collagen intake?
Yes, I'm a believer in oral collagen, and I also will prescribe oral collagen to clients that have done, for those who have done the collagen stimulating treatments such as HIFU, monopolar radio frequency treatment, or the collagen stimulating injectables. So afterward, I would ask them to take oral supplement of collagen at least 1 month, non-stop, because it really helps. It's not just placebo effect. So it really have a difference between those who take the collagen or those who didn't take the collagen. So I usually will ask them to do it, but they have to do it. They have to take it quite. The amount of the collagen must be good, must be high, and then the quality must be good. Yeah.
Right. Okay. And are there any vitamins which can actually stimulate collagen as well?
Yes, they can do it. They can take it with collagen, the vitamin C. So it can also help the collagen stimulation and production. For collagen itself, I recommend them to choose the hydrolyzed collagen, and then the amount is at least 2,500 milligrams. So it is quite a lot for daily use. Yes.
Right. I gather from this conversation, that your HIFU is quite a popular treatment in your clinic. Is that right?
Yes. HIFU actually I have different version of HIFU. I have a doctor grade higher energy HIFU, and a therapist beautician grade of a lower, more easy energy of HIFU. So I have different grade of machine. And in Hong Kong, they love the HIFU treatment because no downtime. They can do it like in the afternoon or lunch break or after work, and then the next day they can go to work without notice. And because Hong Kong people are very afraid of people talking behind them, and especially in office, who work in office, and then they don't like other girls to gossip. Okay, what a lady have done for the face. So for the HIFU treatment is very suitable for our pace of life, and actually it's very effective because we can do it once a year, and we can achieve a result that can last for a year. So they can do it in very minimum of time, and then they achieve that good result, and then they don't have much downtime. So it's very popular.
So would you say that HIFU is a treatment for collagen stimulation, or is it a treatment for skin tightening?
It actually is both, but the theory is that HIFU actually stands for the high intensity focused ultrasound. So it's a non-invasive machine that can heat up the certain layer under the skin to up to 55 to 60 degrees. So because it's very high heat, so it actually damages the collagen underneath the skin. So after the collagen, it creates wound, right? When we have wound, our body will have the mechanism to heal up the wound. Therefore, new collagen will be produced, and new elastin will be produced. It make the treated area become more tight.
What is this craze about skin whitening in the Asian market? And by Asian market, I just don't mean the Far East. I also mean the South Asian countries. Everyone wants to have a whiter skin. I'm not talking about brighter skin. They just want to become whiter. Why do you think there's so much influence in this area of the world to become more white?
I think it's also related to the culture and traditional belief that whiter people actually have a richer or healthier or more elite group of people in the population. So it's not only happen in Asia, as you mentioned. Southeast Asia, Far East also have this concept, and also we have skin type that are more easily to get suntan under the sun, right? So basically, for whiter population, they are more likely to be indoor working classes or well-educated classes, that they don't need to be outdoor and do manual work. So as a concept of in a social concept, so whiter people are actually better, richer, and maybe more intelligent and more pretty. So it's a very rooted concept in Asia, in many Asian countries. So we pursue of whitening. Ladies, especially ladies, we prefer whiter, fairer skin, not only the face, also the whole body. So for the whitening product, the topical whitening, and then the oral supplement for whitening, and even the sometimes an intravenous type of whitening product is very popular in Asia.
Do you provide any of these 3 treatments?
I provide topical and oral. I do not provide the intravenous one.
Right.
I think because the oral one and the intravenous one has the same or similar efficacy, but the intravenous method has more risk. So I prefer the oral one, and then they can do it continuously at home, because whitening, even if the intravenous one, you have to come back every week or every few days. So for Hong Kong people, I think they don't have such a time to just spend so much time for the intravenous treatment. For oral one, usually we prescribe non-medicated oral supplement that can improve the skin color. In my clinic, I would prescribe the carotenoid, the colorless carotenoid. So it's made from white tomato. Basically, when we eat it for a few weeks, we go under the sun, we will be less likely to tan.
Is it something like, and this is something, Dr. May, which I have seen from my own eyes, that if you start eating carrots every day, after about 2 months,
yes,
your skin becomes orange.
Yes, that's true.
Orange because of the carotenoids.
Yes. Yes.
So if you have white carotenoids, your skin will become whiter because it has carotenoid, which are white in color. Is that the basic concept?
The concept is no, not like this, but it avoid the orangey, tingy color of the carrot or tomato that we eat. If we eat a lot of tomato, the normal tomato, we will have orangey color on the skin, right? So we would not like that, because we cannot achieve a whitening effect. So for the colorless carotenoid, that can avoid this problem. But actually, it's not the colorless make the skin colorless. Actually, is the carotenoid that will concentrate on in the skin after we take for a few weeks, and then the carotenoid can prevent the skin from UV influence. So it's a kind of like anti-UV effect. And also it can inhibit the melanocytes, inhibit the pigment producing cell from producing the pigment. So it has 2 effects. So right. It makes us less likely to be influenced by the sun, and then it makes the already existing pigment less likely to produce. So it's whitening in general. So and also because it's systemic, it's oral intake. So we are not just whitening on the face, we also, the whole body will be whitening. So the client will usually say that, okay, the finger will become whiter, or the knees will become whiter. Those are those that usually cannot be easily whitened area.
Dr. May, biostimulator is another kind of filler which does not occupy space. So please correct me if I'm wrong, that there's a kind of a filler available in the market which we put in the patients and it stimulates their own collagen and gives them volume. Is that true?
Yes, that's true. Actually, in the market, there is 2 types of biostimulator. The first one that got the FDA approved is the one that you mentioned about. When we inject, there is nothing to see. After a few days later, nothing to see is become to the original state again. And then you have to wait 4 to 6 weeks to see any effect. And then the total treatment will need at least 3 to 5 sessions. So for the whole process, it will take at least 3 to 6 months. So it's a very slow process, and the theory is like you planting the seed under the skin, and then ask your body to grow your own collagen, and then to fill up and replenish the area that you need volume. So it's a biostimulator or collagen stimulator. But there is another newer type of filler that has both instant filler effect and the biostimulating effect. So those products are from the Netherlands. So it is a more precise product. So you don't need to do massage as you need to do in the first product. But the price is much higher. So usually client will only choose a certain part of the face. It's not a whole face improvement. So it's the difference. But both are collagen stimulating.
How would you decide that where would you want to use the filler which is a biostimulator and a filler which is right in the middle of the spectrum? What will make you choose between those two?
Biostimulator is more like a global improvement for the clients that maybe they haven't done anything before, and their face is really sunken or quite severe. I usually will ask them to do biostimulator first if they are not in a rush. If they are in a rush, so if they have planned, okay, next month I'll go to have my big day in next month. So you don't have much time for the collagen stimulating. So you will directly go for filler or the intermediate filler with biostimulator. So it's the main difference. Secondly, for older clientele, and they don't have any they don't have any big immediate event, right? But they prefer a more gradual effect. And biostimulator have another benefit is that they will improve the skin texture too. So they are not only to replenish the deficiency in volume and the treated area, they will also experience the improvement of the skin texture. Is more obvious in older population. So for those group, I will usually recommend those for the biostimulating. But for specific area, for those very popular treatment like forehead filler, I will use the hyaluronic acid or the filler with biostimulating. Will not use the just the biostimulating effect on the forehead.
Before I let you go, would you have any tips for anyone listening for their skincare and something that they can add to their daily routine for a more healthy skin?
I think sunscreen is a definitely must to do if you are not doing it every day, because a lot of people said, okay, I'm doing sunscreen, but actually I'm doing it when I have the outdoor event or the sporty event, or going to the beach, I will do sunscreen. But no, this is a very wrong concept. You have to add the sunscreen in your daily routine, and then add it as a habit, daily habit, and then continuously doing it for few dozen of years, and then you will see the difference. So because of sun damage is the most important aging influence on our skin, especially those exposed area. So sunscreen is the most important things that we can do to protect our skin from aging. So we can, I will strongly recommend daily use of sunscreen, SPF 30 and above, and PA++. And even for gentlemen, because gentlemen usually doesn't like sunscreen because it's too white or too oily or block their pores or something, will cause breakout of acne. So choose your suitable sunscreen. Yes, there are a lot of different sunscreen that is more transparent, not oily, will not clog pores. So so choose your suitable sunscreen and use it every day, and then make it as a habit.
Is that the crux of the book that you have written about skincare, routine? Because of course I won't ask you to tell us everything that you have written in the book, but apart from sun protection, one more tip that you would like to give us?
Um, for our daily improvement of the skin, I think what we eat is also important. We have to avoid those who cause early aging of the skin, such as the food in high sugar content that will increase our blood sugar level very quickly. Those we have to avoid. And those who cook in a method that is using a grill or deep fried, or those burn with the burn barbecue. Yes. I don't want to say that because you are living in Australia. That must be very popular cuisine. But this kind of cooking method is not good for our skin. So better avoid. So barbecue is really bad. So better for boil, steam, and avoid the very heat method with the oil. So because this will generate the material that is very bad for the skin. So diet is also important.
Brilliant, brilliant. Thank you so much for your time, May. I think it has been fabulous, and you have been wonderful. It has been very informative. I would love to have you again sometime whenever you can spare some more time for us in the future. But before you go, I'm not going to let you go before having a free skin consultation. What do you think I can benefit from?
His facial feature actually is very good for as an example of our main client, because his facial feature is very masculine. You can see the jawline, and then the chin, and then the lips, and the proportion is very good. But all of us will age. Not this year, we'll also age. And with the aging, we gain more weight here, more choppy, and then the double chin, and yes, and a little bit loss of volume on the upper face or the temple. So the sagginess of the upper eyelid. So which make him more mature and basically more attractive. So I don't think you need anything.
Thank you, May. I was not trying to dig for compliments, but you're so right that whatever you've been talking about, all the aging landmarks in a face, if you look at my face closely enough, they're all there. Sagginess, loss of volume, double chin, collection of the soft tissue in the lower third, and this is all we need. And that is to just lift it back as an anti-aging procedure, which is something that you've been talking about this evening. Thank you, May.
Yeah, thank you, Dr.
It's been
Sia.
a pleasure.